Welcome to another episode of Main Street Mental Health. I'm Shannon Paul, I'm a licensed professional counselor, licensed clinical social worker, and substance abuse specialist in the state of Wisconsin, presently in South Central Wisconsin, but I've served in communities in other parts of the state in the past. Today, we're going to talk a little bit about community-based services, um, namely wraparound services or teaming services that been around for maybe different names or different kind of constructs, probably for the past 30 to 40 years. And they've kind of started in different organizational locations, whether it be educational systems, medical systems, or hospital systems, as well as the human services or the mental health substance use arena. Um, and they can be very, very, very helpful. In the past, probably early 1990s, often in the human services world, uh, they were called integrated services. That's where basically you had some teaming initiatives going on, integration of services. In the educational world, we call it M-team meetings or multidisciplinary team meetings, back around the same time period, maybe even earlier. Um, my experiences working in hospital settings, we had something called Grand Rounds, which was basically the team of professionals that were working with a particular patient or client and kind of coming together to kind of talk about goals and progress, things to try, that sort of thing. And also a listening time too for the professionals to hear from patients or the patients' families. So there's been shades of it over the years, that led to kind of more focused development of teaming or wraparound or community-based services. Um, think of it this way: is think from my perspective, outpatient counseling services. Not everyone is served really, really well in an outpatient clinical setting. It's not for everybody. So consider community-based services, which tend to be teaming or wraparound services. Um, in the mid 90s, there was an initiative that was started in our particular state, kind of in the central part of the state, called coordinated service teaming. And that was really kind of having this hub of a service coordinator or case manager that kind of was the broker of looking for services to serve particular goals or needs that a client might present. In that situation, was the family was the client. So that was kind of their focus, very strength-based, very family centered, and really had good outcomes with that as well. That's still in existence today. It's been scaled down a little bit, but still an option for some families in some locales across the state. So coordinated service teaming, CST. It does have other names in different counties, but typically it's CST. I call CST the grandparent of the next one, which is called Comprehensive Community Services, which is CCS. And that one kind of is 2.0 CST and or CST on steroids, I like to call it. And that one is a more robust, wraparound, strength-based, client-centered, person-centered program for all ages. You could have 4 or 5-year-olds in the program. You could have 70-plus-year-old people in the program. It tends to be what they call a recovery-oriented service, which means that it's finite. It's going to have an ending at some point in time. And the average amount of time that somebody's in the CCS program, depending on goals, so on and so forth, is 1 to 2 years. So it is kind of there's kind of that's, and I often tell people that 1 year mark is so important that you start to see your best outcomes from 1 year to 1.5 years to 2 years. It's kind of slow starting sometimes, and it takes a while for you to kind of see some of those noticeable results that you're looking for. So I always tell people to be patient, especially early on. So CCS is it wraps that particular client around with. It could be therapists, it could be skill developers or mentors. It could be parent supports, it could be family therapy, a variety of things. It could have a medical component as well, nurses or whatnot. But it does take a little bit of time, but I think the outcomes are worth it in the end. Often we're working with individuals that have significant concerns across multiple domains in their life. So often that outpatient clinic setting just doesn't quite reach the needs that might be there. So CCS, another good program. There's another program called CLTS, and it tends to be for long-term support for children. And that also has some teaming initiatives and qualities to it. For individuals with some possibly mental health, physical, or developmental difficulties. There's also a CSP program, which is a community support program that's long-term for adults with mental health issues, chronic mental health issues. And that also has kind of a teaming approach to it as well, with a medical component as well, typically. So all those programs are wonderful. They have great outcomes. And they are a little bit higher level of care than outpatient. So keep that in mind. For some people, their issues could be resolved with outpatient. Great. That's you want least amount of impact or involvement, I guess, if it's something that can resolve a particular issue. But for some folks, the community-based ones with teaming, the wraparound approach, it's really hard to beat that. I'm not sure. I'll throw this out there too. Even the medical world, they're still doing kind of those grand rounds and so on and so forth. There's also what they call complex care or complex patient care for medical issues that happen. And so you'll see that sometimes we'll have some calls from typically nurses or social workers from medical entities that are working on kind of brokering services for their particular patient as well. So the wraparound, the teaming, it's pretty popular. It's pretty common because it works well, so keep that in mind. I'm not sure what other states call their programs like this. In what level. Some are probably more developed, some are maybe not as developed as maybe Wisconsin's, but they're out there. So if you are in another locale, whether it's your county or state entity or human services, if you said, is there a wraparound? Is there a teaming program? Is there a program? My kids' needs are greater than just going to a counselor once a week or once a month. What else is there? So check into those things as well. Internationally, other countries, there's probably some countries that are fairly developed and similar to this. There might be some countries that never heard of this and maybe practice in those old silo kind of things where each professional does their own thing and there's not a lot of communication between them. I would lean that that's changing over the years, especially when you see the outcomes you see. Sometimes we have, you bring together people in team meetings and so everybody's on the same page plus, so and obviously the individuals involved know that we're all there because we all care. So that's it for today. I just wanted to plug that for community-based programs, teaming initiatives, wraparound approaches. It's a really excellent way to go, especially if you have concerns across multiple domains of your life or of your children's life or whatnot. So that's signing off today from Main Street Mental Health. I'm Shannon Paul. Just remember, we're just a percentage of perfect, and you take care. Bye.